Welcome back. Well, every other Thursday, we're taking a look at a health issue or concern affecting a lot of people, breaking down the information for you and telling you what you need to know to keep healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topic, waterborne diseases. Good morning. Welcome back, doctor.
Good morning.
Very important to talk about. Even though we live on an island, we spend a lot of time in the water. It is the summertime coming up. A lot more people, a lot more kids will be in the water.
Yes.
Can we talk about fresh water first, such as ponds and streams, and what kind of waterborne diseases we can find there?
Sure. There are a lot of bacteria in fresh water, waterfalls, the ponds, the streams that you mentioned, that enter the body through cuts and abrasions, scrapes, and washing them with soap and water as soon as you can is probably beneficial. In addition to that, if there's a redness area around the cut that is growing, it's a good idea to see a doctor. There are diseases such as cellulitis that can occur, as well as more serious infections like necrotizing fasciitis and myositis. These latter ones require urgent treatment. So for prophylactic antibiotics that the doctor may give you, it includes usually a Keflex and a levofloxacin or Levaquin for about 5 days. And the doctor will want to follow up with you to make sure that the cellulitis or redness is getting better. Tetanus vaccine is not something to forget. If you're not up to date on tetanus and you're in fresh water and you have a cut or a scrape, you should get an up-to-date tetanus booster.
A lot of people think it's fresh water, it's clean, I can't get a disease, but as you said, you can. So what about in the ocean, salt water?
Well, salt water, let's talk about the one that KHON talks about every week, which is jellyfish, the Hawaiian box jellyfish. Jellyfish stings can cause local reactions on the skin, but they can also cause systemic reactions. Heart stoppage, Christine, is even possible with severe stings. You can get back and abdominal pain, nausea and vomiting, sweating, and severe hypertension. So locally on the skin, the treatment is vinegar, so acetic acid. So bring along some vinegar if you're in the season of box jellyfish, 10 days after the full moon, and make sure you have it available if you get stung. Salt water is okay if vinegar is not available. Avoid baking soda. Avoid fresh water, as I say. Cold packs are helpful for the pain, as are hot water showers. And a myth, urine has been used to decrease the pain of a jellyfish sting. In fact, urine causes the sting to discharge more poison into the skin, so urine is not a treatment for jellyfish stings.
So it does the exact opposite that we thought it did when we were growing up.
Right.
Okay, so do not do that. Use vinegar, and a lot of times just go to the lifeguard and ask for help, and they'll have it there.
Right.
Okay. And talk more about leptospirosis, because we hear that a lot.
Yes, a very dangerous disease. It can be mild, it can be severe. It enters the body when we go to fresh water, lakes and streams, waterfalls, taro patches, and after about 2 days of incubation, it causes a fever, it causes respiratory symptoms, headaches, muscle tenderness, and even sometimes a skin rash. If suspected, there should be a history of swimming taken from the patient, either by family members, and then go to the doctor, and it's easily treated. This is a treatable condition with antibiotics such as tetracyclines or a mycin antibiotic. So these antibiotics can be used, but it is deadly if not treated. There are people that die of leptospirosis.
And that's very unfortunate. I know that we have had reported that in the past. Is it true that you have it for life?
Some people can have a leptospirosis subclinical infection for life.
Okay, so it's important to stay aware of it and also kind of prevent it. If you have any kind of cuts or scrapes, maybe don't go in the water at all.
Right. Wait until they've healed.
Okay, thank you so much, Dr. Brady.
My
Have a good
pleasure.
weekend.
You too.
All right, we'll break down the stories you need to know about today. That's next on Take Two.